What's going on, everybody? This is Black Men Sundays. I'm your host, Corey Sylvester Murray, and we're talking about generational wealth, mental health, finance, and business.
It's a Black Man Sunday. Time to put all childish things away. I refuse to be the man I was yesterday. Gotta put my best foot forward and elevate.
And today we have Dr. Trashonda Balcom. This sister is a licensed mental health counselor and professor at Valencia College in Orlando, Florida. She's also the founder and CEO of Enrich Life Counseling and Consulting. She also helps children, teens struggling with ADHD, anxiety, and depression. We're going to get into that. We also have her clinician on the line, Erica Blunston. This sister is a national certified counselor, licensed mental health counselor in Florida, and she's also an anxiety specialist. So, without further ado, Dr. Trashonda Balcom and Erica Blunston, welcome to Black Men Sundays. Sisters, how y'all doing?
I'm doing good. Thank you for having us, and it's a joy to be here on Black Men Sunday.
Erica, how you doing?
I'm doing good. I'm doing good. Happy to be here.
Definitely. So, look, Dr. Balcom, I want to jump right in. How did you go from, being a licensed mental health counselor to owning your own practice?
Yeah, so I kind of say the practice chose me. I had no intentions of building a group, but when I opened, I saw a need for a diverse space, a safe space for diverse individuals to come to, and hence came a group practice. And since that, Erica was actually the first clinician I had brought on when we turn to a group, and we've been able to open the doors and meet the needs of individuals just like ourselves.
Okay, great information. I mean, you're also a professor at Valencia College. So let's take it back a little bit. What made you want to get into the mental health field, and how did you go about doing that?
Yeah, so I had intentions of being a medical doctor, and I was sitting in class one day, like, nope, don't want to live my life on call. So I was trying to figure out another avenue where I could help people. And inside of one of my psychology classes, I got introduced to counseling. And then also being a military brat, I saw how mental health was involved in my dad, especially after he got deployed and the services he received. And so it kind of opened up my heart for serving others.
Okay, great information. I'm going to come back to you. I want to talk to Erica real quick. Clinician, national certified counselor, anxiety specialist. How
Mhm.
did you get first off, where did your whole movement and where did you decide that I'm going to take this step in my life?
I went to school to get my bachelor's in psychology and graduated, and I was just like, I don't know what I'm going to do with this degree. So once I started looking at other options and counseling came about, I was like, okay, like I really like to help people. I like hearing people's stories. That's one of my favorite things to do is just listen to people's stories. So then I went and I took my first class and fell in love with it ever since then.
Okay, and give me some more information. I mean, you're a national certified counselor, LMHCQS.
Mhm.
Explain what that is and explain how you got involved with that.
Sure, absolutely. So when you're going through the process of becoming a counselor, one, there are certain organizations that you can affiliate yourself with in order to separate you from other counselors. So that's where the NCC comes in. LMHC, that was just my work in becoming licensed over the period of just over 2 years or so. That's about the typical time frame. And then just not too long ago, maybe within the last year and a half, I became a qualified supervisor where I now get to give that supervision to registered interns who are just coming into our field
Definitely. And how did you get linked up with Dr. Balcom?
through friends. So I was working with, I guess they were just friends at the time, the Line sisters now, but, or the sorority sisters now, but I was working with them and they were like, hey, she's overwhelmed with the amount of increase that's coming in and the referrals that are coming in. Do you want to, like just help out part time? And I was like, sure. And I started doing private practice. That was my first time doing private practice. And I was like, let's switch this to full time. So I joined her and we've been rocking ever since.
Okay, great information. All right, Dr. Balcom, I'm coming back to you now. Certified pre-K through fifth grade teacher has a solo practice. Four clinicians help children and teens struggling with ADHD, anxiety, and depression. Now, this Black Men Sundays. Our whole show, we about creating generational wealth, finance, business, and mental health. So, from your point of view, what does parents need to do? But my first question for you is how can parents identify if their children has a mental health issue? Because when I was coming up, it was like, nah, just go do some push-ups. You good, go do some push-ups, do some research, do your homework. And then because you're prepared, you won't have any nerves, any anxiety. So from your point of view, from a medical point of view, what do parents need to identify to understand that should I take my child to a doctor or should I just give them the old school medication, if you will?
Yeah. So I think that's a good question. I think when it comes to parenting, there is no one size or one thing is the right thing to do. And so it's really listening to your child, right? Nowadays, our children are very forthcoming with what they're struggling with and how they're struggling and asking to see someone. But it's up to the parent to then take that information and what to do with it. We can still try some of those old school methods, right? But if those symptoms and characteristics still persist and they're not helping to alleviate any of those, then we want to have that extra assistance because everyone has anxiety. It helps keeps us safe. It's our body's alarm system. We need it to kick in. But what happens when anxiety is persistent and chronic? And that can start from a very young age. That can start as a teenager. So there's no certain age, demographic, race that this is just privy to as well.
Okay, great information, great information. And let's go into more detail because a lot of parents, I get a lot of emails, parents are making six-figure salaries, but they're not home a lot. And then when they get home, they have issues connecting with their children. So what type of symptoms or what type of behaviors would you say that parents need to adhere to say, listen, you need professional help in aside from what I'm teaching you at home?
So one of my first thing you said the connecting, right? Connection and attachment can bring up a lot of diagnosis in and of itself. And so that relationship component is very critical. But that relationship also tells us how to have relationships with others. So you may see things such as isolating or withdrawing. You may see impulsivity. You may see aggressive behaviors. You may see fixation with substances. You may see a decline in grades, poor grades. You may see poor social connections. And so the symptoms and what you may see can go on and on and on. You may see some depressed symptoms like not wanting to take a shower. Like that's the number one thing I hear from parents, like the hygiene, the cleanliness. They say like lazy, just don't care. And it's just like, okay, lazy and just don't care could also be some of the depressive symptoms. How long has this been going on? And so some of those things, I think for most parents, they notice more so on grades though. And so if grades are okay, they think everything is okay with their kid. And then when grades start declining, then they notice like, oh, I didn't know this was going on. But sometimes it's just the concern is solely on grades. Like, I just want their grades to improve. But it's like our grades can improve if our mental health is declining too. Like they don't have the motivation or the care for those at that time.
Great. And let's talk about developmental expectations because as a boy, you're going to sound like this, then you sound like this. So, but what developmental expectations can parents expect with their children these days?
Yeah, so our developmental expectations haven't changed. First is just can my needs be met, right? And those are your basic needs: shelter, food, water, right? And then you go into autonomy, like how well can I do something? And so, kids go through that phase where it's like, no, I can do it. And you're like, no, you can't. But in that one, if we can't support them through their exploration, then it turns out as shame. And then they're less likely to engage in something if all we do is just criticize and have that inner voice for them. And then we go into relationships, and then we go into, am I good enough? And so all of these developmental stages grow, and we used to think that they were linear and happen like step by step, but we know that you can jump from each one, and there's no set path for those, but we have some core components that we can go back and look at, to see these developmental stages happening as well.
Yeah, so I guess give me, because parents gonna be emailing me after hearing this. They're gonna say, "Well, Dr. Balcom, tell us some specific, like, what should we look out for, like some type of verbiage, outside of them not, showering, but what other avenues or things that we should look forward to in our children to say, okay, I may need some professional help."
It's really hard because now the social media plays like a big role in everyone's. And so what I'm seeing a lot lately is a lot of like social self-esteem and self-confidence, because they have this very filtered view of what life should look like in comparison to all these influencers and people on YouTube and all of these things. And so whether that's beauty, whether that's how well I can do something, but listening to kind of like when they describe themselves, right? Are they calling themselves name like, oh my God, I'm such a bad kid. Like I never do anything right. Like, oh, that was so dumb. Like listening to when they make mistakes, how are they responding to those? What are the words that are coming out? Um, are they having difficulty having relationships with peers? And when I say that, even going back to school, a lot of the anxiety comes up because kids don't know how to make friends anymore. They don't know how to do something as basic as introduce themselves and say hi and learn like the flow of conversations. They're so used to just sending emojis or memes or not really having to have that extended dialogue or to listen to someone. And so that's very nerve wracking for someone, but it was also daunting to a parent that I was working with, that why do I have to go back through and teach them how to say hi or do all of these things? It's like, because they don't have that skill. So you're always going to be upset when they're not meeting an expectation of yours if they don't have that basic foundational skill. So sometimes we have to ignore the age of our kids and teens and look at where are they at right now, and let me give them that skill so they can get to where I want them to be. And so I even say like now we want to rush kids through. We want them to be able to answer us in adult ways when developmentally like they just cannot do that.
Okay. Yeah, no, great information. I want to ask you this. We've had mental health specialists on the show, and I've asked them this question. I'm going to ask you this question. I'll probably ask Erica. Erica, don't fall asleep now. Don't think because she on the line that you don't go to sleep. I got like five waiting for you too. So just relax. But my question for you is with social media, because I'm born in the 70s. Really, I always say I'm a 90s baby, meaning I knew what was going on in the 90s, even though I listened to the boys and Perfect Gentlemen in the 80s. If y'all know who that is, y'all might be too young. But anyway, my question for you is for parents out there that are saying, I just don't feel the need to have professional assistance. I can take care of this in my own household. We may have had an uncle or a cousin that may have had similar issues, but I feel like I can handle that myself. What would you say to those parents out there?
I would say that you may can handle it yourself, and you may be missing a tool that can even enhance what you're doing. And so I think parents are the experts in your child's life, right? I'm not stepping into this to say I'm the expert in this. Let me tell you about your child. You're the expert on your child, but I'm here to give you some tools and techniques that will, one, enhance your relationship, but also get you both. Because oftentimes parents and the teens or kids have two separate goals. And it's like trying to merge both of those into one world. And so I relate it back to like eye doctors and medical doctors and all of these different things, these different avenues and components that we have that are helping aids, right? And so that's what counseling is. It's a helpful aid. If your child was struggling in reading or something academically, you would get the tools, right? But you still would have to implement those tools. And so that's almost what counseling is. I give you additional tools, but it's still up to you to utilize those things day in and day out because we're just 1 hour a week usually. You live with it 24/7, right? So we could do something that could do it on your own and it may take you a year or some time. But with the help of a counselor, maybe we can decrease that to maybe 3 months and get you to your goal without rupturing or damaging the relationship as well. And so it's a tricky slope trying to be a parent and a counselor. It's almost like trying to be your child's teacher and their parent when those are two conflicting roles sometimes.
And you make a great point. That really just leads right into my next question because you collaborate with the client's medical doctors, teachers, and caregivers to address the mental health needs. So let's talk about that process and how you're able to do that.
Yeah, I think that I look at stuff from a holistic view, right? Things interact and correlate with each other. So if I'm only looking at it from one specific lens, I'm negating a whole part of that child or adult's or teen's life that it's also having an effect on. So when someone comes to me, I'm asking, well, okay, you're struggling with anxiety or depression or suicidal thoughts or any of these things. Well, how is it impacting you? And usually I say, well, it's impacting my job, it's impacting me at school. It's impacting my relationships with others. It's impacting my communication. It's impacting my health, right? Sometimes we have clients who thought everything that they were going through was just medical, and the medical doctor is telling them, like, nope, it's just this. You need to go see a counselor. And they're like, there's no way that could just be mental health. And I'm like, there is a way. Let's talk about your nervous system. Let's talk about biology and psychology and how those things go hand in hand together. Um, and so that's kind of how I like to look at it, because they oftentimes are seeing other prescribing physicians as well. And if we can work together, ultimately we're working for the best interests of that client.
Great information. And let's take it back with you real quick. As I introduced your certified pre-K through fifth grade teacher, how did you get from that to being a doctor? There's a lot of mental health experts that listen to our show, and they want to know how did you get established your own business? Let's talk about all that. Let's get it. It's Black Men Sundays.
Okay, so a clinician is a master's level license. And so when I was going through my master's program, I did not want to come out of school with debt. So I needed a way to pay for school. So I was like, oh, I'm going to go be a teacher. And so that's how I went into teaching. And there was this nice, which is still out there. If you taught like 5 consecutive years, you got back like 17,500. And I was like, bet, I'm going to do that. And so I actually taught for 7 years, but you can renew that every 5 years for those of you who are out there and wanting to do that. And so, but I also knew I wanted my doctorate. So then I still pursued through, and it was a nice way for me to go to school and still have income because I needed to support myself. But then, that's where my passion for children and teens came from. I really loved working with them. And so that's kind of when I was counseling, I was like, oh, I know who I love working with. And it was children and teens. And then when I left the school system, I missed teaching and hence found I could still teach and be a professor at a higher level. So that's what I did.
Got you. And how did you accelerate that to your own private practice from a financial point of view?
Yeah, from a financial point of view, I had started having kids. I have 3 kids, so I needed to support my kids too. But I knew I also wanted to be a very active mother. And so that's when my husband actually encouraged me to open up my own practice so that I can kind of set the schedule that I wanted. And it was very nerve-wracking, like going out and knowing that you're going from a consistent paycheck to now I'm gonna have to be a marketing, an admin, a counselor, like all these roles I haven't done. But when I did step out on faith, I've just been blessed ever since. And like I said, the it was flooding over. Even people were just like, "Oh, you're a Black clinician. You could just." I'm like, "Whoa, whoa, 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 whoa! I don't work with that, but let me see if I can find someone who does." And so that's almost how it came about, because it was just I met a need that was out there. So I was a Black clinician, and I accept insurance, and so it took out that financial barrier that sometimes some people face when trying to receive services. Um, and so it's just been flowing since then.
Great information. That's what I was looking for. All right, Erica. Erica Blunston, National Certified Counselor. For y'all just joining on, this sister is an anxiety specialist, a lead clinician, adult therapist. So my question for you, Erica, I'm just gonna come out the gates. People say, look, I'm tired, I'm burned out, I don't have time for this. I'm ready for some change. As a Black female therapist,
Mhm.
but this Black Men Sundays, what advice can you give?
Well, if you're able to identify that it's time to do some work or that it's time for a change, like that's the first step right there. Because sometimes we can just get lost in what we don't realize is our triggers, our negative thoughts, or things like that. So if you're able to identify, I can't do this anymore, I need a change, that's the first step. And then you start the research process so that you're able to find somebody to talk to and help you work through it.
And what about people that say, I can figure it out myself. My concerns are no big deal.
A lot of people feel that way because there's not a lot of, no, I shouldn't say there's not a lot of, it's growing more with social media now. But we still need more education in order to remove the stigma away, right? So people are going to say, it's not that big of a deal, or I can handle it myself, because that's what we've been taught all of our lives. Like, just do what you got to do, shake it off, it'll be okay. But as we start to introduce more things like, hey, anxiety is an everyday thing that a lot of people experience, when we start to normalize a lot more things, the goal is for more people to get in and talk to somebody.
I got you. Okay, here's my question. I've been waiting to speak to an anxiety specialist. So Erica, I gotta ask her this question today. So my question for you is this: how do you know if you are just nervous or you have anxiety? Because for me, sometimes, if I have like a big report or a big shoot, or I'm interviewing the governor or somebody, you get a little, even though the shoot's at 11, 8 a.m., I'm a little tired. I'm planning, okay, if this doesn't work, if that doesn't, is that nervousness or is that anxiety? And how do we differentiate?
You can tell the difference between how it affects like your whole body, because symptoms start to come into play, right? So if we're talking about being nervous, that's the emotion that you're experiencing, where it's reasonable. If you have something major that's coming up, you are going to experience nervousness. However, with anxiety, that's when the excessive worry starts to come in, and it's almost like you just can't turn it off. It's going over and over and over and over and over again, just like on a cycle. You start to feel tension that's going on in your body, almost like you can't even realize, like, oh my gosh, my muscles are tense. Like, why do I feel so sore? And you don't even realize that these things are going on, but your nervous system is running on overdrive at this point. So it goes beyond more than just the emotion of nervousness.
And how do we relate that, because from an adult point of view, I totally get what you're saying, but how do we, if our child has a test the next day and they're up all night, or they're, Mom, Dad, I can't sleep. Like, how do we differentiate that in our children?
I'm going to toss that back to Dr. Balcom because she is the child specialist.
The first thing that popped in my mind, Corey, have you seen the movie Inside Out 2?
No, I'm sorry. I edit videos and play video games. I don't watch movies.
Well, most kids and teens and families have, but they introduced a new emotion character or feeling character, anxiety. And it showcased anxiety perfect. It was those constant thoughts, um, before an event even happened, the constant worrying, the excessive thoughts that kept going on. But what I like to say is sometimes when that thing that you're nervous about, once it starts going, for most people, those nervous feelings start to fade away. But for those with anxiety and mental health anxiety, is that even in the absence of those, the anxiety still persists and exists,
Wow,
right?
that's no, I got you. I'm just taking that in like, wow, that's pretty heavy. Y'all are both black women in a mental health positions professionally. What does that feel like? Like, what is that like?
I think there's different parts of it. Sometimes it almost feels like, "Ooh, you're a super," for me, like a superhero, like saving, like fulfilling a mission. But sometimes it can feel very heavy because there's not a growing amount of us available that it seems like the weight of it is on us to do a lot. And so those are the two parts I feel with myself. Like on one hand, I feel like I'm doing my missions work and I'm helping, but part of it is like I'm not helping enough because there's still so many individuals struggling that we're not even being able to reach. And I'll let Erica chime in on her part because I'm sure we have different viewpoints.
It's actually not too different. I would say the hardest part about it is wanting to be so involved in removing the stigma and just like we want everyone to just be able to just like look at mental health this way, especially within the Black community. But it's a slow growing process. So that part is hard, like just wanting to fix things so that we can all just work towards our mental health. But we got to take the steps in order to do so. The best part for me is just being able to be that person on the other side where you can look at me and relate. We're gonna be in session, laughing, having a little kiki, and then we're gonna get down to business. So that's the special part for me, just being able to be that person that you're able to relate to.
Great information. And I hear a lot of parents say, yeah, mental health, that's not what we do. We take care of it in our families and we figure it out. We keep it going. For the families out there that don't believe in mental health, for black families, because it's Black men studies, we keep it real over here. For the families that don't believe in mental health, they don't believe that mental health is health. What would you say to them?
That it has to be something else, right? So if it's not mental health, then what is going on? If we're looking at it if we're looking at it from a point of view of, okay, well, I don't believe that it's mental health, then what else could be going on?
Those unspoken needs, those unspoken things, silence does kill, right? And we do enough of that within our own community with not addressing mental health. Because untreated mental health goes into other things, whether that's elevation in crime, whether that's elevation in jail, whether that's elevated substance use. And so sometimes what I see with working with diverse parents is that recognizing this in your kids brings about your own pain that you haven't dealt with too. And that's the scary part. And I think even you don't notice dysfunction sometime until you get older. And again, that's having to validate and say, this did happen. And some people aren't ready to face that for themselves. And so when you have a kid, it's almost like having a mirror for yourself, right? They know how to hit on those unhealed, those wounded parts of ourselves, where we can go around trying to fake the smile, trying to have the best career, trying to do some of those things, but only you know sometimes those inward struggles that you're dealing with.
All right, fellas, the stage is open. Ladies, the stage is open. Say your name, the city and state, and ask your question. Let's go.
My name is Ray. I'm calling out of Rockledge, Florida. What type of advice could you give for someone that's living with someone who suffers with mental health issues? Is that something like a common question you guys get?
Yes. So caregiver, anything, caregiver burnout, stress, psychoeducation. One of the things I always want to make sure is that they understand the mental health illness that that individual has, because oftentimes you may know the diagnosis, but you don't really understand the characteristics of it. And so that psychoeducational piece is beneficial. to know almost what does this look like for this individual. But boundaries are one thing. Communication are another thing that you want to make sure that they know how to, so that they're not enabling any behaviors as well. And oftentimes that's what we see because we think those things are being helpful. But again, without that psychoeducational piece, we don't know if this is enabling or if this is helpful behavior. But I would say the boundaries, right? Because oftentimes when you take on that caregiver role, you have this wanting to fix someone, right? And with that wanting to fix, when those things aren't happening, you take that on. And so then you can take on more depression and more of these things that come about with that caregiver role.
The other thing I would add to that too is just making sure that you have like your own community as well, because of the fact that it can be so much that you're taking on. If you're able to connect with someone who is experiencing a similar situation that like you are, whether if it's in a support group or just somebody that you're able to connect with, that can help just to be able to be around someone who understands exactly what you're experiencing.
Okay, perfect. Perfect. Thank you for that. And I have one other question for both of you. What are your thoughts on alternative therapies such as like psychedelic therapy versus the traditional pharmaceutical therapy in conjunction with therapy? What are your guys' thoughts on that?
I don't have too much of a major opinion on it yet because of the fact that there's still so much research that they're in the process of doing. But what I would say is I would encourage anyone that if you've gone through all of the steps already and it's like these things aren't working and I want to try something else, if you have a trusted provider that you're able to take that step, then then go for it.
And I would say even looking outside of traditional pharmaceuticals or the psychedelics, we talked about having a stigma with just mental health alone. We didn't even discuss the stigma on medication. And so that I think is the next big step because there's so many diagnoses that we have that we know the best treatment method is not counseling alone. It's a combination of counseling and pharmaceuticals, but we have this big stigma with medicine to help that blocks. Whether that's someone struggling with bipolar, anxiety, depression, or any of it, it's like, nope, no medicine. It's like, okay, well, I don't know how far I'm gonna get you, but we're gonna try our best. But there's a lot of different treatments, and so during an intake, we kind of assess like what are those things for you, whether that's religion, whether that's yoga, meditation, sound healing. We try to infuse your coping skills into it. Like I said, we'll have a big toolbox, but this is your life, and we're trying to figure out what works best for you as an individual.
Oh, perfect. Great answer from both of you. And thank you for taking the questions.
You're welcome. Thank you.
Hi, Dr. Balcom and Erica. My name's Stacy Perrin. I'm a clinician working in Seminole County. It's so nice to make this connection virtually, and I loved everything you said today. I have a question. If we have parents listening today, you touched on the very important concept of the impact of social media on children and mental health. Are there some particular strategies or tips or advice that you give parents when their children are struggling with the impact of social media?
I think one thing is assessing for their readiness for these devices. I think that's the number one thing I see that a lot of kids or teens are getting devices and not mentally being ready for it. Also having access and setting up some parameters for what this looks like, whether there's a check-in point where you can read messages or any of that, but establishing some kind of rules and boundaries and parameters with these devices. And then you always want to monitor the time that is spent on these devices. But again, it takes you knowing your child to know what can you trust them with on these, because it's not just mental health readiness, but there are predators out there too. And they get into all of these sites with these kids, and the kids are having full-fledged conversations and giving out personal information. And they come in willingly in the office, like, oh, I was like, you what?
Mhm.
And then the parents have no idea. I'm like, do you not go look at anything? Like, no. I'm
Yeah.
like, okay.
No, those are such good tips. I feel like Corey, you could do a whole show just on that, just on the dangers of social media and intervention. So that was really valuable information. Thank you.
So, Dr. Balcom, let's talk about this Therapy Matters tour. What's up with that?
Yeah, so another clinician that I know who owns a private practice, we wanted to put together something that kind of helped reduce the stigma. And so that Therapy Matters tour was a combination of having a panel discussion with panel experts one day. Another one, we had kind of a community family event, and then another forum for just clinicians to collaborate and network and connect with each other.
Okay. Are there any dates, any, specifics that we can broadcast?
So we haven't set up our dates for this upcoming year, but we are in the planning phase of it. So I will definitely get you that information once we have that solidified.
And this is what I really want to know. This is a business, Black Men Sundays, generational wealth creating show. I know so many clinicians. I know so many licensed mental health counselors where they're like, okay, I need to start my own practice. Give me some tips to get them going. They're already certified. They already have patients, but they're under someone else. So what can they do to just say, I can do my own thing? Let's go.
I think I would really assess like the why wanting to go out on your own versus working for one. Because I think that sometimes we have this idea of on your own would be so much easier, but you also have to remember on your own, you're everything, right? So you are answering the phones, you are doing the billing, you are the marketing. And so although you may make more individually, your time has a monetary value to it as well. But if you did want to go out on your own, first thing would probably be to get a LLC, get your EIN number, get an MPI number. If you were planning to take insurance, you want to get some contracts. That takes at least 180 days to get those contracts from insurance. You would want to get a EHR or what kind of management system that you'll be utilizing, phone system, fax system, and a whole bunch, your liability insurance. And so sometimes when people go through the list of all those expenses that you now it will incur, sometimes like, oh no, I'll just take what I have. Um, but yes, there are many sites where you could probably just Google in like steps to opening your own practice and walk through that. But know your state's requirements as well. And if you choose to practice in another state, know the requirements for both because now you'll have to make sure you meet both as well.
From that financial point of view, what type of money should they have saved up before they say, you know what, I'm going to quit here, start my own practice? Like, what type of money should they have saved up?
I would say at least have 6 months of your expenses saved up because being on your own, there's not a guaranteed client caseload. But you are guaranteed to have those bills come monthly. So you want to make sure that you have enough to be able to maintain and meet those things as well. But I think 6 months is adequate. But that's also considering what your monthly expenses are as an individual too. So you just want to sit down and really map that out, know how many clients that you would need to see at what rate to make your expenses, and then you can plan out some of those things as well.
Because we've had guests come on. I've had probably 20 guests say 6 months of your income of expenses. So now, if we're Uber eating $50 a night, that is a part of that 6 months as well. If we're leaving the carriage lights on all night long, if we're leaving lights on, if we're doing excessive things, that counts as well. Am I correct?
Yes. So I would say 6 months of your personal expenses, and then also 6 months of now your business expenses to maintain those too. So you want to do some calculating and sit down before, but that will also help you to understand what is there going to be your session rate, right? Because that can change. And so now you know, like, okay, I need to at least charge this. I can't accept people for this because if I have like a whole caseload of that amount, like I'll never meet my expenses. But yeah, look at your business expenses and your personal expenses. And then like the biggest thing that clinicians always cry over at the end of the year is taxes, right? Setting aside money for taxes too. So you want to make sure. And now benefits like health insurance and all of those things are probably on your own personally. And so those are some more added expenses that you want to take into account too.
Erica, my last question for you is people say I put everyone else's feelings ahead of my own.
Mhm.
What advice would you give about that?
Being able to know that you are enough, realizing that you do have to be you do have to be in a place to take care of yourself. Self-care is everything. Being able to make sure that you're acknowledging your feelings and not just ignoring them, because the more we suppress our feelings, they don't really go anywhere. They just come back up anyways. So it all just comes back to acknowledging it. So if you are putting everyone else before you, we got to figure out why is that happening, and so we can't do that anymore. You got to take care of you.
I can't seem to find support, Erica. Help me out.
What do you need? What is the thing that you're looking for? What do you need help with? So then we can figure out, do we need to be in a support group? Do we need to, be reaching out to family members, friends, whatever it may be? We just have to explore what your available options are, and then we can build off of that. Therapy within itself is a way for you to be able to get support.
Okay, but Erica, a lot of black people, man, we don't need no therapy. That ain't for us. I ain't about to
Mhm.
spend no money on no therapist, man. Just sit down. Let me give you these gems and take it from there. Come on now, this Black Men Sundays. You already know how we talk. Let's go.
If you are not ready to get started with therapy, look at some resources first, right? Take a look at some podcasts. You can do some self-help books, all of that, just to be able to get more education. The more that we're able to educate ourselves with, oh, this really is something that's like affecting my life or affecting my functioning. That's when that's when we start getting the phone calls. When, oh, okay, I realize that this is taking over my job, my relationships, my parenting, whatever it may be. That's when we get the phone call. So education is everything. And sometimes that can start with a podcast like yours. Sometimes that can be a YouTube video, a book, anything.
Okay. And what about the parents that say, it's hard for me to express my feelings with my kids when I'm with my peers? They feel like they're being judged. So, how can you explore your thoughts and feelings without the fear of judgment or misunderstanding?
When it comes to peers, you do want to be able to find someone who is that safe space, right? So if there is that fear of judgment, there has to be a level of trust that's being built. That's one of the first things that we do in therapy also. It's like building that therapeutic relationship. So when we're talking about the outside world, it's a matter of finding ways to build that trust so that you are able to be more vulnerable with them and start to identify what the emotions are, and then you can start to feel it and then share it with other people. I would say when it comes to children, it's a perfect way to be able to model what you're feeling. So if you are exhausted from work, or if something happened at work that made you extremely angry and you're coming home and like you're talking to your children about it, this is what I'm feeling, this is how I'm handling it. It's a perfect way to be able to model for our children also.
Okay, great information. That's what I'm talking about. Okay, so Dr. Trishonda Balcom, Erica Blunston, my final question for both of you guys, because I feel like mental health is starting to make way in our community, but it's still not where it should be. So if you're talking to parents out there, if you're talking to adults out there, if you're just talking to anybody out there listening to Black Men Sundays, what advice would you give on the importance of mental health counseling?
Keep an open mind and just be curious about what it has to offer to you specifically, or to your children. If we do stay in that curiosity, then it leaves that open door for being educated for what we're actually able to do.
And I would personally just say that we all have areas of strengths and weaknesses, or areas that we can improve. And that's kind of what counseling is there for. But counseling is not an easy approach. Counseling is facing some of those things we try to suppress. And so be ready to do the work. Be ready for it to be maybe painful, right? Sometimes I like to tell people it feels worse than what you were doing before you came because we're intentionally exposing some of your wounds, right? So when we do that, it feels like it's not working. But we have a plan, we have some goals, and we'll help you get that way. But be ready to work, right? It's not just coming in here just to talk and then do whatever you want for the rest of the week. We're giving you some things to do at home so we can get to an end point. And I think that's one of the things some people think counseling is just this easy walk in the park. I'm going to talk and I feel better. It's not. Sorry to bust that bubble for you. And so that's what I would say to an individual. You don't have to do it alone. We'll be there step by step with you.
Dr. Balcom, Erica Blunston, are you guys enjoying yourselves on Black Men Sundays?
Yes.
I am.
This is a great
Even
time.
more
What a great
if they do a
conversation.
rib.
That's what I'm talking about. What'd you say, Erica?
No, Dr. Balcom said even more if you were sharing ribs.
Oh yeah, we're gonna have
Because we
to.
like to eat too.
Yeah, I know, but only because you went on West 2 show, I can't give you no ribs, baby. We channel 6 over here. Because you went on Breakfast with Bridget, I might can give you like a half of one. But
I'll even take them little burnt ends.
that's what I'm talking about. Well, hey, Dr. Trashonda Balcom, Erica Blunston, thanks for coming on Black Men Sundays. Thanks for sharing your insight, great information. And we look forward to linking up with you guys in the future because what I'm trying to work on is I'm trying to set up a symposium where I'm going to have 3 mental health experts on talking about various topics. So one that I just created, well, not created, but one that Erica gave me a tip on today. So I'm going to take that to social media and apply that. But thanks for coming on Black Men Sundays. We appreciate you. We appreciate your time and enjoy your week, ladies.
Thank you. You too.
It's a Black Man Sunday. Time to put all childish things away.